Welcome to Pharmacy Practice News Meeting Highlights, our new convention coverage program. We're here at the 2017 ASHP Midyear Clinical Meeting in Orlando to bring you the latest research and reports from today's professional poster session. For more information, log on to www.pharmacypracticenews.com. Lynn, thank you for joining me on Meeting Highlights.
Wonderful, thanks for having me.
Tell us a little bit about yourself and what prompted you to do this study.
So I'm the National Director of Pharmacy Operations for Ascension. Ascension is the largest not-for-profit Catholic health system. We have over 141 hospitals. We knew that heart failure was an area that we could make an impact. So we wanted to look as a national team on how we could reduce the number of readmissions related to heart failure.
And what was your goal?
So our goal was to reduce heart failure readmissions by 4% by the end of fiscal year 17.
And you formed a toolkit?
Yes, so we have a toolkit. It's over 90 pages. It's located on our intranet, and it helps people walk through all the steps of how do you counsel patients, how do you do a polypharmacy review, how do you provide access to medications for patients. So we wanted to make sure that they had access through patient assistance programs and the Dispensary of Hope. The Dispensary of Hope is something that we rolled out during this time as well. We started with 17 Dispensary of Hopes, and now we're over 47 Dispensary of Hopes.
And you have a monthly call system where you, I guess, touch base in an interdisciplinary way?
So we've held monthly coaching calls where we highlight one of our ministry markets' best practice, and we share that best practice. In addition, we answer questions, we go through the guidebook. We've also done continuing education. We have tried to provide the most information to our hospitals that we possibly can. The other thing we did is we developed a national dashboard so that we could track this and identify this as well. And we've developed a clinical decision support tool to help identify patients who have heart failure so that our pharmacists can make the intervention. And we develop process metrics and outcome metrics. At the end of our implementation period, 92% of our hospitals, or 100 of our N of 101, had implemented this across the system. We identified a 5.1% overall decrease in heart failure readmissions. So we made over 1,400 interventions that otherwise would not have been made to improve the care of our patients.
Great. Were there any other things in among your discussion points that you wanted to bring out as well?
So pharmacy plays an integral role in providing outcome related to heart failure, and we're currently implementing a national patient assistance program. We've done the Dispensary of Hope, and we're doing the national patient assistance. The one thing that we haven't been able to do is when we look at the readmission rates for all of Ascension, to actually differentiate which patients had pharmacy counseling and which didn't have pharmacy counseling. So the overall rate that we have right now is just a general rate. There's a chance that it could be better for those that had pharmacy intervention versus not. The data derived from our clinical decision support based on that diagnosis of heart failure, the RAISE and BMP, and the heart failure medications does contain false positives. Sometimes a patient looks like they're going to be a heart failure patient, but they turn out not to be. So we have false positives and false negatives in identifying the patients. That's why this number's lower. But once we know who is actually to be counseled, we have higher numbers of who's actually been counseled. Not all sites were included in this, in the data collection, only because the commercial clinical decision support that we use has not been rolled out in all of our hospitals, and it's in a majority of our hospitals. But we developed a homegrown rule that we developed for those. Let's see, the data collections were modified in July, so that might have impacted some of our numbers as well.
Great. So what are the takeaways from your program that you
Absolutely.
Want to
So, but all the steps we've talked about could be done with any kind of disease state. You should develop a best practice toolkit, bring that evidence-based medicine literature together, have monthly coaching calls, highlight best practices, do peer-to-peer coaching. If someone needs some extra help, do that. Develop a national dashboard so that you can make sure you have metrics and you're monitoring to make sure that you're making the implementations. Bring in leadership, have accountability. Everybody needs to know, and you need to be communicating this. And then the other thing we did specific to this, or it could be with any disease state, is have some way that patients can get their medications, Dispensary of Hope or the Patient Assistance Program.
Any final take-home messages for our viewers?
No, it's, you can do this. It's worth bringing together the team so that you can make a difference in your patients' lives, and just following a few simple steps of a toolkit and coaching calls and a dashboard and, just working together as a team. Just break it down and you can be very successful making a difference in patients' lives.
Great. Lynn, thank you so much for joining us on
Great.
Meeting Highlights.
Thank you.
For Pharmacy Practice News and Meeting Highlights, I'm Dr. Linda Bernstein.